Okay. Well, hello, everyone. My name is Kate Evans. I'm the director of Duke Law School's new Immigrant Rights Clinic. I'm delighted to welcome you to today's event, which is part of the COVID-19 Advancing Rights and Justice During a Pandemic. This series is co-convened by Columbia Law School's Human Rights Institute, Duke Law's International Human Rights Clinic, Columbia Law School's Center for Gender and Sexuality Law, and Just Security. Today's panel will address how refugees, migrants, and asylum seekers face particular risks due to COVID-19 and its responses. With the spread of the pandemic, countries and service providers must grapple with the increasingly urgent need to provide adequate healthcare, sanitation, water, and housing for immigrants. At the same time, we are seeing governments such as the United States and many others use this crisis as an opportunity to close their borders to migrants and asylum seekers. Today, we'll talk about those international norms, the advocacy efforts underway, the new needs that service providers are requiring, and the particular harms faced by these populations. We're joined today by three leaders in this area. We'll begin with Gillian Triggs, Assistant Secretary General and Assistant High Commissioner for Protection at UNHCR, the United Nations Refugee Agency. Then we have Sana Mustafa, Associate Director of Partnerships and Engagement at Asylum Access and a founding member of the Network for Refugee Voices, who will be followed by Bill Frelick, Director of the Refugee and Migrant Rights Division at Human Rights Watch. Each speaker will provide a presentation for approximately 10 minutes, followed by a moderated question and answer period. If you would like to pose a question for our panelists, please tweet those using hashtag COVID-19Justice, or you can use the Q&A function on Zoom to share questions with our organizers. And we'll do our best to reach these after the presentations. With that, it is my great pleasure to hand the floor over to Assistant Secretary General Triggs. Thank you very much.
Well, thank you very much, Kate. And I must say, it's a very great pleasure for me to be with Sana and with Bill to discuss this initiative. It's a great pleasure, of course, also to be in an academic environment where I haven't been for a while, and to be able to hear the voices of representatives or advocates for refugees. So this is a good initiative, and because it has been or proved to be a particular challenge in a time of COVID to advocate effectively for the legal norms that underpin the work of UNHCR. So my message today is really a simple one. We must learn to work as scholars, members of civil society, as government officials or members of the business community, and of course with the UN itself, for human rights and the international legal principles that have protected refugees and those forcibly displaced and stateless for many decades. Well, the UN Secretary General has declared the COVID-19 pandemic to be a global health crisis, unlike any other in the 75-year history of the United Nations. The pandemic also creates an international protection crisis, for in the face of COVID-19, we're all vulnerable. It's quite often, or the point is quite often made, that the virus does not discriminate in its victims. This is true, but the impact of the virus is discriminatory, disproportionately affecting the victims, affecting the poorest and the most vulnerable people in the world. Over 71 million asylum seekers and refugees, the internally displaced and stateless, are particularly vulnerable. 3/4 of them live in overcrowded camps and settlements, makeshift shelters or reception centers, very typically in urban areas where they lack access to adequate healthcare and sanitation, social distancing, and hand, if not impossible, many of them. Persecution. In short, we have a health emergency on top of pre-existing crises, prompting the movement of people globally who are in need of protection. As countries battle to protect their populations and economies, fundamental norms of refugee law and human rights law are at risk. It's ironic, of course, that as we enter with the Refugee Convention, the 70th anniversary of that convention, signed, of course, in 1951, the legal norms that underpin our mandate have been challenged when many millions of those in need of international protection are at levels. But I'm also reminded of when I UNHCR towards the end of last year, and it was a time of great optimism. The Global Compact had been accepted by the international community with some core that have been so important. Global solidarity, but particularly the sharing of the burden and responsibility for all those in need of international protection. And a year later, just after I started, we had the Global Refugee Forum, at which states, civil society, the business community made over 1,400 pledges and commitments to implement that compact. Who could possibly have imagined that the principles and the commitments made in relation to the compact would be challenged so profoundly and so quickly by the global pandemic? And who could have imagined that we'd learn why international responsibility and burden sharing will prove to be so important to our global survival? So what are the legal principles that I'm talking about and that I think are at risk? Well, one of the most potent threats to the right to seek and enjoy asylum is presented at the border of a state. UNHCR, through its 400 or so field offices, through our bureaus in many parts of the world, we know that 167 countries have fully or partially closed their borders to contain the spread of the virus. And 57 states make no exception whatever for access to asylum seekers. And with these border closures and the denial of entry comes the restriction of access to asylum procedures to be able to make your claim as a refugee, the disproportionate use of administrative detention, so-called, and the denial of access to critical protection services. There are many elements that are of concern: port closures and refusals of disembarkation. We've seen it in the Mediterranean, of course, over a number of years, and very recently, just in the last few days, in the Andaman Sea, where 400 Rohingya approximately seeking asylum were denied access to a port in Malaysia, and we found that more than 30 people have died of starvation and dehydration. Well, it's long been recognized that asylum seekers have a right to seek protection at these borders. They may not be returned directly or indirectly to a country of persecution or danger. That principle of non-refoulement is one of the most widely accepted norms of customary law, customary international law, and the 51 Refugee Convention and other instruments. In addition to these problems, we've seen now the genuine risk of refoulement, including the phenomenon of chain refoulement in Central North America, and I think Sana is going to speak about that, with more than 10,000 people expelled from the United States to countries in North of Central America, along with a rather uncoordinated policy in Mexico to decongest detention centers. We also have the legal phenomenon of the resort to externalization of legal responsibilities to third countries, often poor countries with non-existent asylum procedures and fragile health systems. So we are seeing countries knowingly violating the principle of non-refoulement through deportations and forced returns. And this has led to an unprecedented situation at UNHCR, because we've now been forced temporarily to suspend our resettlement program. And as many of you will know, resettlement is what we do. It's what we're known for. It's our brand, if you like. We help countries either directly or through our own programs to identify those who meet the standard of refugee, and we try to resettle through host countries. With the borders closed to planes, we've had to suspend those matters. Well, as a matter of law, how do we respond to these threats? The UN is very clear in saying that, of course, sovereign nations have the right to temporarily close their borders to limit transit, and of course protect their public fundamental responsibility and duty of states. But in order to do so, those measures must be non-discriminatory, necessary, proportionate, and reasonable in all the circumstances. We argue, and we believe it's right, that a state has a duty to protect its citizens from health pandemics, but also an obligation to protect refugees. You can do both. They're not mutually exclusive ideas, and we believe that using quarantine, testing procedures, innovative use of technology, which is happening in a number of states, where face-to-face interviews, for example, is not possible, it is possible through remote interviewing, and case processing of asylum claims is going ahead. But the longer term concern that I have as a lawyer and as a member of UNHCR is that the kinds of restrictions that have been imposed, with many consequences for asylum rights and the prohibition of non-refoulement, may be justified arguably as emergency measures, but we fear they'll become entrenched or baked in once the corona crisis passes. It will pass, but there may be a determination by some countries to continue to maintain those regressive policies. So we need to be vigilant in upholding the rights of refugees to protection that can be protected in the context of this context. We are, of course, concerned that the virus will hit with the greatest severity those communities that are marginalized and poor. So beyond the core legal points that I've been raising, we have a social and economic crisis, which is likely to go on for a very long time if we listen to the advice of OCHA, of the World Food Programme, and others who are very close to the field. We have, of course, growing evidence of the social and economic impacts on the communities at large. And as the High Commissioner for Refugees has said many times, this is not essentially a refugee crisis. But the reality is that the impact socially and economically will hit refugee communities, displaced persons, stateless people around the world. And that is really our concern. We are seeing evidence of discriminatory restrictions on access to health and social services, the loss of livelihood, especially for urban refugees who are typically employed in the global, in the casual economy, and are invariably the first piece of people to go when there's any kind of business crisis. I should say that there are many examples where we see this form of discrimination, but equally we're seeing a number of countries who are assiduous in ensuring that refugees and displaced people are included in their national programs. So it's a very variable environment. For very obvious reasons, states are more willing to include in healthcare programs because the obvious risk is contagion, and that refugees need to be brought within those systems, but much bigger challenges with regard to livelihood, access to social services, and so on. One of the areas that has caused perhaps one of the greatest levels of consternation by member states of the UN has been sexual and gender-based violence. Again, we don't know the actual figures. We do know that the lockdowns and strict confinements, loss of income, isolation, psychosocial needs have led to a spike in sexual and domestic violence in general populations throughout the world. And we're seeing dramatic rises. We expect that refugees and displaced people will be particularly susceptible to the kinds of strains that inevitably happen in households where a breadwinner has lost his or her job, and where people are locked down in circumstances where they can't have the usual access to services or even to friends and family. The sorts of things that keep us all sane are particularly at risk of loss for communities, and we think that sexual and gender-based violence will increase. We expect that to be particularly a problem in relation to children. And that brings me on to the very particular needs of children. It's a shocking fact that about 50% of refugees and displaced people worldwide are children. And the closure of schools locks them into what can be very fraught family environments amongst the refugee and displaced population. About 1.5 billion children are currently out of school, as estimated by UNICEF, and we fear that the persons of concern to us will be very vulnerable to exploitation, to child labor, even to trafficking, forced marriage, of all of those things that happen to stressed families. There's also a phenomenon in relation to children that some countries have discontinued their documentation of births, and we fear that there will be a rise of statelessness. There are increases in xenophobia, where I think we need much greater leadership to push back against the profound misinformation that displaced people and refugees are vectors for the coronavirus. Well, there are many others. I should finish, but I'll finish by saying that not only are we concerned about the normative legal principles underlying refugee protection, but we are arguing that one of the safest ways for the moment of dealing with the social and economic impacts of the pandemic are to include people in national systems. If that is the case, then we have a much better chance of non-discriminatory means of ensuring access to social services, psychosocial support, and so on. So can I conclude broadly where I started, which is to return to the spirit of the Global Compact on Refugees. It's vital that we have international solidarity, that we return to the idea of sharing. We need to support the vision of the Global Compact and to advocate for international legal norms of protection. We need, I think, when the coronavirus has subsided, to regain lost ground for the normative principles and return to the international rule of law. So thank you very much indeed.
Thank you so much. Sana?
Yeah, thank you. And thank you for having us and organizing this together. Maybe I would just give a very quick brief about Asylum Access for those who don't know. And so Asylum Access, it's a US-based organization, but we work in Mexico, Thailand, Malaysia, Jordan, Lebanon, and eventually in Ethiopia, hopefully this year. And what we work on is really challenging legal barriers that prevent refugees from moving freely, staying safely, having access to labor market, having access to education and health services. So before this crisis, we've always been advocating for this kind of missing gap in the response sector on refugee, which is the legal and policy side of the work. And of course, in light of COVID-19, the populations that we work with, the forcibly displaced persons, now more than ever, they are facing higher risks to their lives, and which the assistant to the Secretary Triggs highlighted perfectly. And maybe one of the things that I would mention about the risks, that of course access to healthcare is one of them, but and as a solution to that, our colleagues in national offices and on a global level, we have been advocating alongside refugee-led organizations and civil society organizations to guarantee refugees the right and access to healthcare. However, it's very important to mention that once we do that, there is another piece of the work that we should be aware of, especially that actually, for example, Mexico yesterday with our colleagues in Mexico have worked with the civil society there to advocate with the Mexican government to guarantee refugees and detainees the access to healthcare, which gladly the court yesterday approved that. The important piece, I think, and questions that for all of us to think about, which we as Asylum Access also have been working on, is the risks that come after having access to healthcare. I mean, first, the financial barrier. Having access to healthcare doesn't mean it's for free in all countries where refugees reside. So there's still the economic barrier. And the second one is the discrimination that potentially refugees could experience actually while having access to healthcare, because they don't have legal documentations and they're more vulnerable. And so we need to also ensure that this access to healthcare is safe and it's economically supported. The other things that we've been seeing in our where we work and globally is, of course, the increased level of discrimination and arrest and detention of refugees, especially actually in light of the lockdowns. Like, for example, our colleagues in Malaysia have set up recently a bail fund, actually, for refugees who have been detained for breaking the movement control order, or not wearing the personal protective equipment, and that, and then asked for legal documentation. So in actually all cases in our clients, we have noticed that they were traveling or moving, breaking this movement control order for basic critical reasons. And because again, like they don't have the privilege that we have of of doing social distancing and staying at home. And what's very important is that these abuses and these violations of refugees' rights don't go undocumented at this time, because they are increasing, and that we fight for them. Which actually brings me to one point that we've been advocating for as Asylum Access, is that the consideration of legal workers as essential workers. Refugees, again, they are going without any documentation and being detained and arrested. And so besides setting up the bail fund to release refugees, but we also need to ensure that they have right for legal representation, and that legal workers are considered actually essential workers. Maybe I would talk again also, our colleagues also in Malaysia and Mexico and Thailand have adjusted all our delivery of legal services to, of course, online. So now we're doing everything through phone, WhatsApp, radio, hotlines. And so we're adapting to the context that we work on to ensure that despite everything, forcibly displaced communities, they know that there are people they could contact for potential violations of their rights, and that we would provide the protection and the services that we can. And maybe one example I would also mention, on a global level, we are partnering now with refugee-led organizations and national-led organizations to design a joint advocacy global campaign. And the purpose of this campaign, not really just to focus on COVID-19, but if anything, to use and seize this moment to make the argument that we've been working on for decades, that denying refugees legal status documentation only results in very bad outcomes for the refugees and host community themselves. And we can see it now more than ever. So how can we ensure that we learn from this crisis and we prevent that for future crises? Which brings me to the point of that, especially now considering that the restriction of movement for international aid workers and humanitarian workers, now more than ever, it's time to empower national civil society, refugee-led organizations. They are on the ground and they are there. And so as we cannot travel as NGOs to those places, it's very important that we consider channeling and signaling our support to refugee-led organizations and national-led organizations, because they have been able to navigate their own context and continue to deliver services. I'm going to stop here and would look forward to receiving questions.
Excellent, thank you so much. And Bill, I turn to you.
Unmuted? Great, thank you. All right. Well, good. I want to pick up on the comments that I fully agree with from both of the previous speakers, and try not to be redundant with them. I wanted to organize according to three areas to cover. One is the right to seek asylum and to prevent refoulement, which the Deputy High Commissioner spoke to. Also, the second area is to really look at confinement of refugees and migrants, either in detention centers, refugee camps, and similar types of confinement and the conditions of confinement. And thirdly is broadly the discrimination and the application of public health measures with respect to refugees, asylum seekers, and migrants. So let me jump right into the first part, which is the one, the critical question about what does happen at borders and the right to seek asylum. We got some very revealing statistics just now from UNHCR about that, and let me tease it out with a couple of specific examples. And I'll start, of course, with the United States, which is where we're sitting at the moment with Duke, Columbia, and many of the people on the call. What on March 20th, the order that came from the Centers for Disease Control and implemented by Department of Homeland Security was basically a restriction on travel across the southern border, actually the northern border as well. But it wasn't a full restriction, and even the announcement yesterday of this restricting immigration is not going to be a complete restriction. There will be exceptions for essential travel, and this often involves business travel. It involves citizens, of course, returning to the United States. And what we're simply arguing is that people that are seeking asylum, people that are fleeing persecution, people that are fleeing threats to their lives, freedom, their physical integrity, are essential travelers. This should be considered as essential travel. And the CDC order doesn't mention asylum at all. It just ignores it completely. It just talks about irregular border crossers. And part of the fear that we have here, it's not just the fear of that this will become the new normal and ongoing practice, but it's that these become pretexts or excuses essentially for policies that the certain governments have wanted to put in place for some time. And I'll just quote President Trump as saying, we've had this problem, meaning irregular border crossing, for decades, and now it's a national emergency and we can actually do something about it. So it looks like using an emergency as an opportunity for taking measures that the government was inclined to take during normal periods of time and couldn't get away with, basically. And we've seen these measures number of Hungary has done very similar things, Brazil, Uganda, where borders have been closed without exception to asylum seekers. And in some of the most dramatic, I think Gillian Triggs mentioned with Malaysia, the pushback of boats from the Malaysian government of Rohingya refugees, where a boat with almost 400 people on it, 30 of whom died, was left to drift in the Andean Sea for a very long period of time because it had been pushed back, supposedly reprovisioned with food, but not enough to feed those people who ended up starving at sea. And we've also seen Malta and Italy, declare that their ports are not safe ports for people rescued at sea. And Malta, having just recently transferred asylum seekers and migrants to the Libyan Coast Guard to be returned to Libya, which leads to my second point, which is about detention conditions for migrants and conditions of confinement for refugees in quite a number of places. When you look at the detention centers in Libya, we have been documenting for years abysmal conditions, very abusive conditions in these places. And of course, they're no better now than they've been throughout this crisis, and in fact, in many respects worse. Healthcare is not provided. People are jammed together in extremely overcrowded conditions, and hygiene is virtually impossible. I was just last week, I was in the Moria camp in Greece. Last month, did I say last week? And when I was there, seeing a camp that was designed for less than 3,000 people with more than 20,000 people there. We actually just did a press release today in follow-up to my visit there earlier to talk to people in the camp about the conditions. And even though some measures have been taken to try to prevent the onset of COVID-19 in the camp, and thankfully we don't, although there are registered cases on the mainland, some of the mainland camps, as yet no cases are known, although they're known on the island of Lesbos, not in that camp. But the conditions there are primarily ones of people that are condensed, pushed in a congested area where they have to line up in the hundreds for food, and they can't possibly social distance themselves, and they don't have access to running water throughout the day. There is inadequate sanitation, and the real imperative here is to decongest these camps and make use of, for example, you have the tourist industry in Greece that is basically ended at the moment, and the availability of hotels, for example, to use to in part stimulate that economy with the use of refugees and giving them a safer place to stay. We also have done work on the Rohingya camps in Bangladesh, which I've also visited, and there again, overcrowded camps, measures being taken, but at the same time, the restrictions on the camp, they've just, since November, surrounded the camps with barbed wire. They've closed off internet access, so people don't have the ability to communicate about what they need to do to take health measures or to report on the conditions that they face. I'll leave it at that. And let me just give one example on discrimination, and I'll pull from Lebanon, which is, of course, a country where a quarter of the population are refugees. It's one of the most beset host countries in the world. And yet over time, there have been many discriminatory measures, both towards Palestinian refugees and Syrian refugees. Now, 78% of the Syrian refugees do not have legal status in the country. And while there's a general curfews that are imposed from 8 p.m. to 5 a.m. for the population as a whole, individual municipalities have created new, additional curfews specifically to the refugee populations with no basis for providing curfews that essentially allow them only to move from 1 p.m. to 5 p.m. Additional discriminatory measures, for example, saying that from the informal tenanted settlements, only one person is allowed to go to the supermarkets or to the bakeries to get food for those camps. And there's a self-reporting mechanism now for people to report COVID-19. But when you have stripped people of their legal residency and people are afraid of being deported to Syria, it undercuts your ability to have people report that they actually think that they may be infected with the disease. So these discriminatory measures, at some point are going to come back to haunt or to bite the host community. All blame, of course, doesn't go onto any of these host communities, Bangladesh, Lebanon, you name them. We do need international solidarity of the kind that Gillian Triggs was talking about earlier. And this has to be considered as, an international imperative and one that basically we're all in together. So I'll leave it at that and welcome questions.
Wonderful. Thank you very much to each of you for your remarks. The questions are coming in, and I'll try to organize those a bit into groups here. I think starting first with a challenge that many of you referenced, just in terms of documenting the dangers that refugees, migrants, and asylum seekers are experiencing right now as a result of COVID-19, given the travel restrictions, the remote access, the inability to actually meet face-to-face with a number of the people who are most immediately affected. And one example was raised from one of today's participants with respect to whether or not your organizations or other organizations are able to even monitor rejections and turnbacks at the border of asylum seekers in violation of international obligations. I don't know, maybe Bill, if we could start with you and we can kind of go in reverse order and see if the other speakers want to address that.
Yeah, I mean, it's always an enormous challenge to do that, but even more so right now. I'll mention a couple of things. We have documented for years pushbacks at the Turkey-Syria border, for example, and we believe those pushbacks are still happening now, but it is increasingly difficult for us to actually document those pushbacks. I mentioned, the pushaways of the boats by Malaysia, Malta returning people summarily to Libya, and of course the United States here is now summarily returning people who cross at the southern border without detaining them, without putting them through procedures to basically return them directly to Mexico if they're able to do that, or to the countries of origin, or even to so-called safe third countries. We have the asylum cooperative agreements now that have been signed with Guatemala, El Salvador, and Honduras, and deportations have continued to Guatemala. And some of the people that were deported, of course, have been reported now as being COVID-19 positive as well. But basically, the approach that's been taken has been to strip these fundamental principles that have been in place for decades to assess claims before sending people back. And when you have the United States doing this summarily, that I think becomes an invitation, of course, to other countries that have far less capacity to be able to do what we can manage to do, which is to examine asylum claims while at the same time protecting the host community from the spread of disease. And you can isolate people, you can quarantine them. It has to be proportional, it has to be reasonable, it has to be based on, you know, the science and not on some xenophobic fear. But these are measures that can be taken and need to be taken because, as I said at the outset, this actually is essential travel, and it is something for which international law has long recognized an exception to the general principles that countries can determine, you know, who they want to immigrate into their country.
Sorry, it might have been, my mute might not have worked. Senator Dr. Triggs, did you want to add any comments there with respect to access to information?
Sana, do you want to go?
I was just
okay. I'll
go ahead. I'll let you go.
We're being very polite. We won't be by the end of this, possibly. I'll go. Look, yes, I think the question is a very important one because it is difficult to document, and I know very well from my work that unless you have the figures, the statistics, and the evidence, it's not always easy to make your argument with quite the credibility that we want. Of course, if we go to the sexual gender-based violence, for example, you might notice that I was being quite careful about saying that there's a risk of substantial increase for women in refugee situations, but we actually don't have concrete evidence to demonstrate that other than at an anecdotal level. So all we can do is extrapolate from what we know are accurate figures from France, from Ecuador, from the United States, Mexico border, and so on. So there are ways of doing it, but it is extremely difficult. There are also ethical questions that I'm sure at a law school you'd be thinking about, and that is, you know, can you really go in to do the kind of interviewing that you want to do to get accurate information to people who are stressed, traumatized, and in a terrible state? And you probably can't. So, but having said that, as I said earlier, we at UNHCR, we have 400 field officers, and we have 7 bureaus, 6 of them in represented parts of the world. We have a quite impressive ability to gain the intelligence, to gain the information from the fields and to know that what we're saying is accurate. The other is that we've got wonderful research staff who can look at the legislation of every country and say, we know that 167 states have closed their borders and only 57 are allowing, etc. So there are ways of doing it. And as Bill has said, there are other very obvious ones, which fortunately the media can illuminate, being, for example, the turn back by Malaysia of the Rohingya boat, and we can trace that through. We also know a number of examples of the Mediterranean. So I think it's a case of forensically putting the evidence together, but I do think it's crucial because in this sort of post-truth world, the UN, above all entities, has got to be absolutely right. And I know, of course, that's what universities and other institutions really want to do. Get your evidence right, then you can make your advocacy point. Thank you.
If I may add to this,
we
don't necessarily, as Asylum Access, work on documenting rejected requests for asylum at the border. However, on the US side, but what we do is actually documenting the violations of giving refugees and asylum seekers in Mexico the right to seek asylum. So we document that, and we also challenge the national system over the 3 days period of seeking asylum, and we do representation in the courts. Especially now in light of COVID-19, we're also documenting detention, and we're doing a lot of advocacy work on detention and release for migrants and refugees in Mexico.
Yeah, relatedly, and sticking with you, Sana, for a minute, one of the participants today was asking how we can provide a voice for refugee groups, migrant groups in this moment of remote work, and how you're partnering with various organizations on the ground and people, directly affected by the situation to sort of speak out with them in today's crisis.
Mm-hmm. Yeah, that's a great question. And as I mentioned in the beginning, it is unfortunate that a lot of the international aid workers and development workers are unable to travel to those places where refugees are, but also maybe it's an opportunity for all of us to see how we can channel resources and work with the communities that are already there, with refugee-led organizations and national-led organizations. So I would encourage all of us to rethink the design of our advocacy campaigns, of our programs and service delivery, to think how we can work with refugee-led organizations. Because, it has been mentioned how difficult it is, especially in such circumstances, to talk with refugees on even documenting what's happening to them. And no one is better at this than the community themselves. And so leveraging that is very critical. There are big numbers of refugee-led organizations and civil society-led organizations, national ones, that also waiting for opportunities actually to partner with the global one to kind of do this mix of global and local voices and elevate those voices louder. And I think that now more than ever is the opportunity to do that. And so partnering with refugee-led organization is one way. Funding and resources. There's that one of the issues that might be hard to partner with refugee-led organizations is that they don't have the capacity. And they don't have the capacity because of the restriction of access, the systematic restriction of access and limited access to fund that they have been experiencing for decades. And so there is that kind of problem of that. Even if we want to work with them, very few are very well established that you could work with. So maybe that's also another opportunity to think of how we can fund and empower refugee-led organizations. And I always say it's not really rocket science. What it takes having a conversation where both partners, are aware of where they stand and that kind of, the privileges and where they come from, and acknowledging that and really having an honest conversation of how we can work together and empower each other.
Dr. Triggs or Mr. Frelick, do you want to add anything here in terms of how to partner with refugee organizations themselves in the midst of some of the restrictions we're all facing and in the normal ways in which we do our work?
Yeah, I do have a thought to add to that, which is that while we certainly want to encourage refugee self-help. We want to, and refugees are doing heroic self-help measures in places like I mentioned, Kutupalong camp in Bangladesh and the Moria Center in Lesbos as two examples. But I think we also need to recognize that they don't have the tools to be able to protect themselves here. And so, when people are forced together, when in the case of Bangladesh, they are denied access to the means of communication, even when they can't socially distance themselves from each other because of confinement. Self-help can only go so far, and I think we need to recognize that. Yes, they are partners in advocacy. We need to partner with them, help them to try to amplify their voices as much as we can. But we also need to recognize that they can't do it alone, and it's not a question of self-sufficiency here. It's a question of basically making policy decisions that don't put them at such a stark disadvantage that they're not actually able to protect themselves.
Thank you. Yes, Dr. Triggs?
Yes, well, I can only really add to that by making some basic points. One is the enormous importance of the NGO community. working at the local level particularly. And that goes to the point of evidence. Again, the NGO community, refugee advocacy groups can be enormously powerful as witnesses to what is happening. So that was one point. The other is that UNHCR is working very, very hard to ensure that the refugee voice is heard in all of our decision-making and public events, trying to engage them more and more with the kind of considerations that we're giving to refugee rights. Now, it's a small start. There's a very long way to go, but we certainly embrace and advocate for the principle that refugees should have a voice to be able to make their to make their points. Finally, we are also trying to use refugees to tell the stories. There are some marvelous stories, and Bill and Sana are very aware of them, really heartwarming stories, but I make the point that Bill makes is quite right. Of course, they can be only very small because the resources are so few. But one that I rather like is that there's a group of journalists in Burkina Faso who've set up their own radio station and are getting out information about the coronavirus and how to deal with it. These are really wonderful stories, and they do turn public views into a positive, but it's limited.
Well, the next set of questions has to do with some of that balancing act that I think all of you have referred to in terms of not seeing public health and humanitarian protection as trade-offs, but rather things that countries have obligations to do both. And so in this process of quarantines or remote representation and assessments of refugee claims and travel restrictions, how can countries protect the public health of the individuals seeking protection as well as the residents in those countries while meeting their obligations? Are there particular restrictions that are possible while also honoring our obligations internationally? And maybe Bill, let's start with you.
Yeah, I mean, the principles here are the principles of necessity and proportionality that, for example, when you look at something like migration detention, this is an administrative detention. It's not a punishment. And, if people cannot be deported, then the legitimate aim of migration detention evaporates. And so you're left with the question of, what's the basis for holding people that haven't been charged or sentenced to as a penalty, but are being held pending their removal from the country. And so we have to look at alternatives to that, while recognizing that, okay, if there is a real public health risk, assess what that is and assess the measures that you need to take in order to ensure that you don't spread disease. And so, if that means isolating people, to get agreements for people to isolate in place, and if they have a place to go, and you can confirm that, and you can supervise release with check-ins, then people can go and join their families and be supported in a place where they're not going to be confined together, where the chances of infecting each other, infecting the staff, and when the staff go home to their families, infecting their families, you're not necessarily protecting yourself because there's no hermetically sealed way of dealing with this. And so we're basically saying take rational, reasonable measures that are not discriminatory, that basically as Gillian said, the disease itself doesn't discriminate. It's the impact of the disease that does discriminate. And we have to look at that and basically say rationally, what is required for public health? And none of us want to risk public health. There should be unanimity on that question. And that includes the refugees themselves. The refugees are petrified that they're going to, in these closed places, that they're going to contract the disease. They're taking every measure they can possibly take to prevent that from happening. And they're going to continue to do so. And we should trust that and recognize that they're partners in this, in trying to control this disease from spreading. And just to reiterate that there are imperatives here, but they're not really competing imperatives. You can do both at the same time. You can protect people from refoulement, and you can protect the public health, and we need to be able to do both of those things.
Thank you, Sana. Did you want to add to that?
Yeah, I couldn't agree more. And on a personal thought, actually, like one of the things that a lot of refugees in host countries have been waiting for to be resettled to Europe or North America for years. And a lot of them, their travels have been put on hold due to COVID-19 after, like some were traveling next week or some or this month. And one of the things is that, as Bill mentioned, with taking the right measures, this doesn't need to be on hold, because those governments anyway are actually running repatriation flights for their own citizens. So, and they also offering, for example, with Canada, they're offering government-paid shelter for 14 days upon arrival from being overseas for their citizens and permanent residents to actually stay there to make sure, they're taking all the health measures. And so I don't see if refugees that have made it to the last phase of resettlement, why to hold that back for years versus just like your citizens and PR residents, bring them on with the right, measures, health measures, and there's those, shelters for 14 days. So there is a way that at least even the numbers are very small, because we know the most refugees stay in host countries. But for those who had this hope just up there waiting for them, there is a way, I think, to advocate for such policies and measures.
Thank you. And then Assistant Secretary General Triggs.
Well, I think the main points have been made. I think it's important to keep at the center of our mind that governments are entitled to embark on restrictive policies if they are necessary and proportionate to achieve a legitimate aim of protecting national health. That's the test. But the reality, of course, is very different. And it's very, very hard to argue against that in the public arena. So the job of advocates is to try to explain that it's not a binary issue, and that you can both protect public health and give this special right to asylum seekers, which is an absolutely fundamental and well-recognized principle of law. And I think that people can be sympathetic to that, but you do have to look at what quarantine is in place, whether it's possible to do the asylum process with remote processes of interviewing digitally and so on. There are ways of doing it, but it depends on good faith, political will, and a determination to balance these rights.
Thank you. I think we have time for sort of a final constellation of questions, and you can take this in a few different directions. A number of today's participants are asking about the long-term negative effects that may flow for some of the government restrictions on migration and humanitarian protection. Of course, in the United States, we're expecting an executive order, if it wasn't announced while we were all here, suspending migration at least at some level for the next 60 days. But a number of scholars and advocates and policymakers have spoken about how COVID-19 both reflects and reinforces deep societal inequities on lots of different spectrums. And so are you seeing a similar dynamic? And so relatedly, do you see opportunities to address some of the more fundamental problems with respect to the rights of refugees, migrants, and asylum seekers through our responses to COVID-19? Can the crisis create an opportunity to address some of the underlying inequities that are being revealed by the pandemic? Assistant Secretary General Triggs, would you mind starting us off there?
Thank you. Well, thank you, and that is a terrific question, because that's the future, and we should grasp it. I am optimistic. Different once this pandemic subsides. I think we will be looking at things through different eyes. We could achieve some significant changes in the future. As you introduced the subject, what COVID-19 has done is expose the weakness, the inequality across the world, pockets of deep poverty, but also very fragile health systems. Shocking to read that some countries in Africa have 1 or 2 or 3 ventilators for populations of 20, 30 million people. It is absolutely shocking realities of what, and we're of course giving a lot of consideration to that because we don't know where this next phase of COVID is going to come out, and the risk of spreading in a camp is too horrible to really think about, but we have to think about it. But yes, I think that once this is over, of course, it's wonderful to have health as a mechanism, because health is something we're all interested in, and everybody is vulnerable to it in one way or another. So I think what it's done is underscore the point about the globalization, about the need for solidarity. So the global health systems will be one of the leverages, if you like, to start saying we have to look at these problems differently. We have to look at social systems differently. I think we're going to make a strong argument for inclusion in national systems. In other words, we can no longer afford to exclude vulnerable and particular groups, obviously displaced people, stateless people, and others, people who haven't got documentation, and for people who need to be included in the work environment. So I'm actually quite encouraged by what I can see is the future. We are seeing a degree of solidarity globally. And I think that based on fundamental principles, and I think we can work towards those positive outcomes. So yes, I think grasp those opportunities, and let's see if the world can be a better place once COVID has subsided. Thank you.
Excellent. And Sana, moving to you.
Yeah, I couldn't agree more. And maybe I would just reiterate and add that yeah, this moment, I mean, I personally received a lot of messages from friends and people in my community, kind of finally understanding what we've been living for 9 years as refugees, and understanding the different elements of quarantine and limited restriction on movement and ability to work and access to healthcare that we literally, as a Syrian refugee, have been experiencing for 9 years. And so there is space for solidarity at this moment, because we're all in it together this time, and not only with refugees, again, even those citizens who less in poor situations are also experiencing the impact of COVID-19. And so this is an opportunity to think how we can, for refugees in host countries, how we can include refugees in national systems, especially in healthcare, education. That shouldn't be a privilege. This again should be right, if not for refugees, it's just in the benefit of the society as a whole, to ensure that in future crises, because it's non-avoidable at this point, that at least we as community are more prepared, and we have similar circumstances in facing this together.
Thank you, and Bill.
Well, as much as I'd like to end the session on an optimistic note, I have to voice some fear here that the inequalities that we're seeing in the world may actually, the gaps between the haves and the have-nots may widen here. The impact not just on health, but on self-sufficiency, employment. I think of children and education. I mean, many education programs for refugees have been suspended as a result of the isolation, and the resiliency, the capacity, here again, the self-help capacity, while we're very impressed with efforts that refugees have made to try to sustain themselves, they're faced with just enormous challenges, and the fear that we talked about back in the Iraq refugee crisis of trying to avoid a lost generation. Are we going to be looking at lost generation in terms of education for this cohort of refugees worldwide? Trying to find a glimmer here of a silver lining. I'm hopeful that maybe on the detention front, that alternatives to detention, we may be able to look and see, as governments decide that it's not a good idea to confine a lot of people in migration detention and administrative detention. And seek alternatives to that, that might provide opportunities for rethinking the necessity of detention and whether there are other ways of being able to achieve the aims of detention without actually putting people into those conditions. So I see the most hope there, I think, in practical terms for the groups that we're talking about. But I have some real concerns about the impact long-term on impoverishment of already marginalized groups and the future for children in particular.
Well, that brings us to the end of our time here today. And I want to thank each of you for drawing our attention to some difficult realities and possible responses that would improve the situation for refugees, migrants, and asylum seekers, and what we can all do to call for more appropriate responses today. Thank you to everyone for your questions. Apologies for those that we were not able to get to. They were excellent, and I tried to do my best to get opportunities for the panelists to respond to each of those. The recording from today's panel, including closed captioning, will be available on the website for the series within a couple days, along with all of the past panels, which have been excellent. And more information is available also on Twitter at the hashtag COVID-19 Justice. I encourage everyone to join for the next event in the series, which will take place on Tuesday, April 28th. This will address movements, organizing, and empowerment in the time of COVID-19, and likely build on a number of the threads recognized today. Thank you again to our panelists and for everybody joining us today.
Thank you. Thank you very much.
Everyone.
Enjoyed it very much. Good to meet you all. Bye-bye.
Bye-bye.
Bye.